The complete restoration of the severely worn and damaged dentition is one of the most challenging procedures in dentistry. To successfully restore and maintain the teeth, one must understand how the teeth arrived at the state of destruction and take corrective measures to prevent it from recurring. Tooth wear can result from abrasion, attrition, and erosion. Other factors such as trauma, decay, malocclusion, tooth loss, and simple neglect can destroy a dentition. Research has shown that mechanisms like this rarely act alone, and there's nearly always a combination of processes. Of course, we want health and function and long-term prognosis. But when extensive treatment is performed, we also want to optimize the appearance of the teeth and smile. Smile design techniques are utilized to perfect the appearance of the smile. It's a true merger of art and science. The process begins with a comprehensive examination. Digital photographs, digital radiographs, and almost always a diagnostic wax-up. The diagnostic findings are evaluated and the proposed treatment is developed. Often a PowerPoint presentation is created to illustrate the proposed treatment. This is then presented to our patient. When accepted, we complete a diagnostic wax-up. The wax-up can be created directly in models or virtually on the computer and milled. It serves as a scale model, a prototype of how the planned restorations will be designed. Once the wax-up features are approved, custom digitally created lab temporaries are fabricated. Then actual treatment can begin. Often other specialized treatment is required before ideal restorations can be completed. Orthodontic treatment is helpful to move malpositioned teeth back in their proper position. Sometimes implants are placed to support crowns where teeth have been lost. Prosthodontic treatment is usually the last step. During a series of appointments, the teeth are prepared and provisional restorations fabricated. They are sized and shaped very much like the final crowns and veneers. They are resin and not ceramic, so they don't look exactly like the finished product, but they can be readily modified if needed. This allows us to further preview the design of the new smile and complete any refinements that are needed. We must be certain that you get the smile that you want and will love. After the patient wears these provisionals for a few weeks to confirm that the smile and occlusion are great, the final restorations can be fabricated and inserted.